Mr. Chairman, ladies and gentlemen, I am here to talk about our study that analyzes post-operative renal function after mitral valve surgery performed with minimal invasive or conventional sternotomy approach. We believe this topic is significant because patients undergoing mitral valve surgery are known to be vulnerable to kidney damage. Acute kidney injury occurs in over 7% of these patients, and the mortality of those who require dialysis after surgery has been estimated to be greater than 60%. The traditional approach to operate on a mitral valve has been through median sternotomy. However, the multitude of recent technological developments has allowed the less invasive techniques to become the approach of choice at many specialized centers worldwide. One of these methods is 6 to 8 centimeters right-sided mini-thoracotomy. The rationale behind this transition towards less invasive techniques has been that reducing the size of incision results in less blood loss and less pain, causing lesser amount of inflammatory response, resulting in a decreased amount of end organ injury, resulting in a quicker recovery overall. Nevertheless, the literature on this topic that would directly address the effect of the choice of the surgical approach on the renal outcome is limited, and the evidence that is available is not conclusive. So for that reason, our study asks whether mitral valve surgery performed with a minimal invasive approach result in a lesser degree of kidney damage when compared to sternotomy. So we've recruited all of our patients undergoing first-time isolated mitral valve surgery in a given time frame, and we've ended up with 27 patients undergoing the minimal invasive procedures and 170 patients undergoing sternotomies. As you can see, we've included both mitral valve repairs and replacements. I've then retrospectively analyzed a prospective computerized database collecting all of the creatinine clearance and plasma creatinine values recorded preoperatively on day 1, day 4, and day 7 after the operation. The creatinine clearance values were calculated using the Cockcroft-Gault formula, and they are corrected for patients' weight and age. This analysis was performed for the entire population, as well as the specific subgroup of patients with preoperative renal dysfunction. So, as you can see from this table, both of our study groups were comparable in terms of the majority of clinical and demographic data, with the exception of the cumulative Euro scores. So this first figure represents the progression of plasma creatinine values over the period of follow-up. The higher the level of creatinine in plasma, the lower the kidney function. And interestingly, there's no statistically significant change in the levels over time, and there is also no difference in between the two groups, as demonstrated by the widely overlapping confidence intervals. Adequately, when the creatinine clearance was analyzed, this increases with improving renal function. Again, it showed a minimal change over time that was not significant, and the two groups were no different. So faced by this result that clearly rejects our initial hypothesis, we then thought, well, perhaps the difference will become significant if we only focus on the subgroup of patients with established preoperative renal dysfunction. So to do that, we've divided our population into normal and compromised preoperative renal function, and we've used the cutoff point of creatinine clearance of 50 milliliters per minute, which has previously been used in research. So this figure only includes those patients with preoperative renal dysfunction, and surprisingly, just like in the entire study analysis, there's no significant change in the progression over time, as well as between the two groups. And this finding, again, is replicated by analyzing the creatinine clearance values. So in terms of the critical appraisal, we believe that our study benefits from a consecutive and unbiased population selection, as well as a collection of complete data. We are, however, fully aware of some of its limitations. So in summary, our study shows that mitral valve surgery can be performed safely. And what I mean by that is it does not result in post-operative renal dysfunction. And secondly, the choice of surgical approach has no effect as far as the kidney result is concerned. Thank you very much.